So the United States made a decision that researchers estimate will kill somewhere between 780,000 people this year and 14 million by 2030. And that number, it's not in your news feed. It's not even trending. It's not even being debated because none of those deaths happen in one place at one time. They're scattered, invisible, and that's exactly why they get away with it.
While Washington was burning its own credibility down, Canada was building the alternative, and almost nobody is talking about that part.
So today, the story that connects all of this, Ebola in the Congo, what it actually takes to stop an outbreak, what happens when the country that was supposed to be there isn't, and why Canada just became the partner countries are now calling first.
So let's start with the Democratic Republic of Congo. Ebola is moving right now. Over 1,000 suspected cases and hundreds of suspected deaths. And the response funding is nowhere near enough.
And here's what I need people to understand about Ebola. Because Ebola can be contained. It's been done multiple times. But containment isn't magic. It's infrastructure, contact tracing, local health workers who know the community and are trusted by the community.
And all of that, every piece of it is built over years. You don't improvise during a crisis. You need people on the ground before anyone gets sick. You need them building relationships, and they need the capacity to make a fast response possible.
USAID funded a massive share of that infrastructure globally. The local organizations that had spent a decade building and trusting communities that will absolutely not cooperate with a stranger who shows up mid-crisis. So let's go to the numbers. Brooke Nichols at Boston University, public health researcher, not a politician, not an activist, modeled what happens when you gut USAID. 780,000 deaths. 1 year. Over half of them children. Harvard, they ran the same models, got the same conclusion. The Lancet, one of the most respected medical journals on the planet, extended the projection. 14 million preventable deaths by 2030 if the cuts continue.
And when you cut that aid, well, sure, the ball looks fine for a while. The building still stands and it seems normal. But then an outbreak starts, and suddenly the response is slower, and people start dying who didn't have to die. What is cruel about this is that the deaths don't generate a news cycle. They're invisible by design. A child dies of a preventable disease in a clinic in eastern Congo, and the death is not connected in any public narrative to a budget decision made in Washington 2 years earlier. The cause and effect are separated by time and distance and thousands of other variables.
Here's what's even more infuriating. USAID wasn't a charity. It was about relationship building. Governments remember who showed up after the flood, who funded the clinic, who kept food moving during the lean season. That goodwill takes decades to build, and you can burn through it faster than anyone in Washington seems willing to admit.
And Canada gets this. We're one of the few countries still funding global health infrastructure at scale. But we didn't make a big announcement about it. We just kept showing up. And governments, they remember that.
Yeah. Canada has committed $8 million to help the global Ebola response, including support through the World Health Organization, Africa CDC, and the Red Cross Network.
And all of that matters because this is exactly the machinery that the Ebola response depends on. It's not speeches, it's not hashtags, or some political guy standing at a podium saying, "We're monitoring the situation." It needs actual people on the ground that include health workers, labs, surveillance systems, community outreach. The stuff that sounds boring until the only thing standing between an outbreak and a regional disaster.
And it definitely goes beyond Ebola. Canada has also pledged over $1 billion over 3 years to the Global Fund to fight HIV, tuberculosis, and malaria. That fund doesn't just hand out medicine willy-nilly. It helps build health systems. We're talking labs, supply chains, disease tracking. The same backbone countries need when the outbreak hits.
And listen, Africa is not some side note in Canada's aid policy. Ethiopia, the DRC, Mozambique, Nigeria, South Sudan, they're all among Canada's top aid recipients. So when people say, why should Canada care? The answer is simple. Because disease does not respect borders. Instability doesn't stay inside one country. And influence does not sit around waiting for you to come back after you've walked away.
And here's the part that they don't want you thinking about. While American influence is evaporating, China is filling the space. So is Russia and regional powers. Not because they suddenly discovered a humanitarian concern. No, but because the table was set and someone walked away from it. And now Beijing is already on the phone offering an answer to the question, who's actually going to be a reliable partner in the coming years? And that's the real story here. Canada is still in the room, quietly, imperfectly, but meaningfully. And governments remember that. Communities remember who funded the clinic, who helped train the health workers, who supported the testing lab, and who disappeared when things got hard.
Because global health is not a charity, it's a strategy with a conscience. And if Canada wants to be taken seriously in the world we're moving into, this is exactly where we should be right now. Not pretending we can solve every crisis, but helping building the systems that keep crises from becoming catastrophes. So what's interesting about Canada's position right now, and this is the thing I don't think enough people are connecting, is that we're not doing this through some grand announcement. There's no press conferences where Prime Minister Carney declares a new world order. We're just showing up constantly.
The global health funding that didn't get cut when USAID was gutted, the aid commitments that actually get delivered, not just announced.
None of these are accidents. They add up, and other countries are forming opinions about Canada based on that pattern. Not based on what we say, but based on what we do when we think nobody's watching.
And here's the uncomfortable truth for Washington. The United States spent 70 years building global influence, relationships, trust, the kind of goodwill that makes other countries pick up the phone when you call. You can burn through that faster than anyone wants to admit. And right now, countries that have been receiving American aid for decades are doing practical math on who's actually going to show up for them in the next 10 years.
And Canada, whether we plan for this or not, is coming out looking like the adult in the room. Not because we're doing anything flashy, but because we're doing the thing that America used to do. We're showing up, following through, and not treating every humanitarian crisis as a political liability.
So let's come back to that number we talked about off the top. 14 million preventable deaths by 2030. The Lancet published it. Harvard cited it. Boston University modeled it. And the response from the people who made the cuts that will cause those deaths has been, well, basically nothing.
Because the deaths don't generate news cycles. This will probably not be seen. Everything is invisible by design. It's spread across years and countries and causes that never get publicly connected to the decision that triggered them. And that's the strategy. Make the consequence diffuse enough, delay it enough, and scatter enough, and then suddenly nobody can point to it and say, you did this.
Except we just did. And the question we want to leave you with today, and we really want to hear from you on this, is what do you think happens when the country that built the global health infrastructure turns face and walks away from it?
Do you think other countries will fill the gap along with Canada, or does the gap just get bigger and more people die?
And drop your thoughts in the comments, because this needs to be talked about. We need to have a conversation around this, because that's where things can actually get done.
And make sure to share it with other people, because the mainstream media is not reporting on any of this, and we have to get the word out. There are people suffering in this world in silence, and that shouldn't be happening in the 21st century.
Thanks for watching, everybody, and we'll see you tomorrow.